drugs, injections, surgery, and adjuncts for joint pain. Most of you will already be taking some painkillers or have done in the past to manage your symptoms. These are the current recommendations for pain relieving medication for your joint pain. Paracetamol is often the first medication that the GP will offer you. It is a simple painkiller with very few side effects if used correctly, and therefore can be used for long term periods. It is more effective with regular dosing, as advised on the packet, rather than waiting for the pain to arrive. It can be provided either over the counter or prescribed. We also then have our non-steroidal anti-inflammatory drug gels and creams. These are applied to the skin. These include uh, the ones such as your I Believe and your Voltarol. These can be used with or instead of paracetamol, and you can get these also over the counter or they may be prescribed to you. These can be used for long-term periods as well. You've got your capsaicin creams, which are based on chili peppers, and these block pain messages to the brain. We have our anti-inflammatory tablets. So these are your non-steroidal anti-inflammatory drugs. These can help relieve pain by reducing inflammation around the joint. They may be used with paracetamol if paracetamol isn't effective on its own, but it also can be used instead of paracetamol if paracetamol is ineffective. They can be they can cause some side effects such as heartburn, nausea, skin rashes, and stomach ulcers, and therefore are only normally provided with medication to protect the stomach lining. And this can be drugs such as omeprazole and lansoprazole. They can also slightly increase your risk of heart attacks or strokes. Therefore, you should always speak to your doctor, as they may not prescribe them to you if you have heart disease or if you have had a stroke previously or any circulatory problems in your limbs. They may also be cautious about prescribing them if you are at risk of heart disease or a stroke. You shouldn't take more than one non-anti-inflammatory, non-steroidal anti-inflammatory drug at one time, such as if you're using aspirin. If they are taken for long periods of time, they can cause damage to your stomach lining and therefore are only recommended for short term use. If you are buying them over the counter, it's recommended that you read the leaflet inside, as they may not be suitable for people with kidney problems, asthma, allergies to aspirin, or if you have stomach ulcers, or if you are taking warfarin. Always check with your doctor if you are unsure before taking any medication. If you need to take anti inflammatories over a long period of time, always check with your doctor. We have two different types of non steroidal anti inflammatories. So you've got your non selective non steroid anti inflammatory drugs, such as your ibuprofen, your Nurofen, and your Voltarol. They work on both COX-1 and COX-2 inhibitors, and these can be bought over the counter or via prescribed if they are for stronger versions. You have your COX-2 inhibitors and your COXIBs, and these are designed to treat chronic pain and inflammatory conditions without affecting the stomach lining. However, they are more likely to cause side effects on the heart compared to your traditional non-steroidal anti-inflammatory drugs, and therefore they are only prescribed. Your next level in this pyramid is your opioids, and these are your strong painkillers and are sometimes provided if greater pain relief is required. They are only used if other pain relief methods do not work. They can lead to dependency and addiction, and side effects can include nausea, vomiting, constipation, drowsiness, and dizziness. For example, you've got your codeine, and it combined with paracetamol, which is cocodamol, is available over the counter. Separate opioids are available on prescription only. And then at the top of the pyramid, you've got your corticosteroid injections. This is delivered to a specific joint to aid some anti inflammatory processes. It's a short term uh, injection, and it can help with settling our pain flare ups. It's only mainly used when people are experiencing moderate to severe pain, and you can only have a certain amount of these done per year. As you can see, there's arrows on the sides of the pyramids. You can go up pyramid to manage your pain, but once your pain has settled, you can also come back down that pyramid as well. Our pain fluctuates, so it's figuring out what is best for you at this time. When your pain is worse, you may need to go up that pyramid, but as it settles, you can come back down again. We have alternative treatments as well. Things such as acupuncture and TENS machines can be used in managing our joint pain. For acupuncture, there is not enough significant evidence to recommend acupuncture for arthritis. It may provide a short-term pain relief for some people, and it is thought that it does alter the pain messages that are being sent to the brain and can also work on releasing chemicals such as endorphins, which can reduce our pain hormones. Our TENS machine, which stands for Transcutaneous Electrical Nerve Stimulation. It's it's a small electronical device that sends electrical impulses to the nerve endings via a pad placed on our skin. It produces a tingling sensation which helps to block pain messages being sent to the brain. It can be bought in chemists. Some people find it very effective and some people don't. You cannot use this if you have a pacemaker. And then we have our injections and we have our surgery. So when things do get to the point where it's too painful, we may look at injections. So corticosteroid injections can be very helpful, like described earlier. But for some people, it's difficult to manage their pain. So we may then start to think about surgery. This is our final process. You will try everything before you go down the surgical route, and this can either be a joint replacement, managing a microfracture, or arthroscopy. And again, like we've said before, pain fluctuates. And the same with that pyramid. You can go up that pyramid in managing your pain, and you can come down depending on where you are with your pain management.